Okay guys, it's Dr. Oubre. I want to talk a little bit about reflux and heartburn. I saw a patient yesterday and I realized that so many Americans out there are struggling right now with heartburn, reflux. They're taking these medications, Dexilant, Nexium, Omeprazole, Prilosec, and I include Zantac and Famotidine in there. Which is Pepsid. And so these are acid reducing medications, and people feel like they're stuck on these medications because every time they try to come off of them, their heartburn or reflux or cough or whatever your symptom might be comes back. And I'm here to tell you that you weren't born with a Zantac deficiency, you weren't born with a Nexium deficiency. So why are you stuck on these medications? Something has gone wrong throughout your life to cause you to be in this situation. And so contrary to popular medical belief, there's an alternative medical theory that says that instead of making too much stomach acid, you're actually not making enough stomach acid, and that's what's causing your heartburn. So there's tons I can talk about with heartburn and reflux, but today I'm just going to talk about why that makes sense. Why it's actually low stomach acid that might be causing your heartburn and reflux and not high stomach acid. Let's first start off with the conventional medical thinking. The conventional medical thinking says that your acid is too high and that's why you're having heartburn in your throat and the stomach is splashing acid in your throat, and that's why you just have too much acid. But you've had too much acid in your stomach for years. That's what the stomach is supposed to do. It's supposed to make acid. It's supposed to break down our food. So why is it all of a sudden going awry? Why is this happening? And so the alternative theory is not enough stomach acid. So the stomach has two ways to break down food. One is chemically. It uses the stomach acid to break down the food. Primarily this is fats. Proteins and sugars or carbs don't really require a lot of work by the stomach to break down. That's mostly done in the small intestine. Carbs are really easy. That breakdown actually starts in your mouth. But fats are a lot harder to break down. It's like mixing a balsamic vinaigrette. When you shake it up, yeah, there's oil there, but the oil likes to separate really quickly. Oil and fat is harder to break down. And so when your stomach starts struggling to break down the fat because there's not enough stomach acid, it relies on its second means to break down food. That second means is squeezing or churning. And so if it can't break down the food chemically, it just starts churning. The problem is that the stomach has two outlets. It can either go down into the intestines and digest the food, or it can go up. The problem is that the down outlet is closed tightly. The down outlet will not let food in or food through until it's appropriately broken down and the acidity is at the right level. So when you can't break it down with this acid, the second step is churning, and you're trying to force that food through even though the stomach can't push it through. The upper exit to the stomach, called the lower esophageal sphincter, or LES, is not so strong. It's actually considered a false sphincter. It's not a good one. This may sound gross, but your butthole is a good sphincter. Nothing comes out of it unless you really want it to or unless you're having a problem. And so that's a good sphincter. The upper sphincter leaving the stomach is not a good sphincter. It lets stuff through easily. So the more your stomach churns, the more likely you are to get acid to shoot up your throat. Now, acid is acid. Your throat is not designed for acid. Your stomach is. So any amount of acid, even if it's not much, shooting into your throat causes symptoms. And the symptoms of reflux can be different for every person. One person will experience heartburn. Many people don't experience any heartburn, and they're considered silent reflux, but they'll get the coughing, or one I heard recently is a globus syndrome, and that just means you've got a sensation of something stuck in the back of your throat or a metal taste in the back of your mouth. These are all symptoms that acid is shooting up into your throat, and the reason why is because the stomach is spasming and churning and trying to break down this food. The alternative way of thinking might seem a little unusual and it might blow your mind, but I promise you once we talk about it and make sense that you will probably consider doing it, especially if you've been on these medications. So the alternative way of thinking is that instead of reducing the stomach acid, we actually increase the stomach acid. So before you freak out and close this video, listen. If the stomach is struggling to break down food, because it doesn't have enough acid and it's churning instead, let's add acid in. And so how do you add acid to the stomach? That sounds crazy. Some people drink vinegar and that just does not taste good. Instead, there's supplements called betaine, HCl, which basically HCl just stands for hydrochloric acid. And so when you take HCl and it mixes with water and contents in your stomach, it turns into acid. So once you aid the stomach in breaking down the food chemically, it doesn't have to rely on the churning and squeezing motion that happens, and all that squeezing and churning creates gas, and that's why you might burp more than other people, or burp more as you've been on these medications and struggle with digestion. So the way you take these stomach acid pills is you actually take it with a meal. So if you're going to sit down and eat some eggs and bacon or cheese, then you want to take these stomach acid pills. And so the dose ranges for everyone a little differently, but the usual treatment dose is upwards of 1,300 milligrams of stomach acid with a meal. Now, I usually tell people start small, go with 200, 300, 400 milligrams and test the water. If you get heartburn when you take the stomach acid, because remember, it is actual acid. So if you get heartburn when you take that medication, then your stomach's not ready for the acid. It doesn't mean you don't need it. It just means that your stomach's not ready for it. The stomach is designed to have acid in there, and the way it allows acid to be in there without digesting your own stomach is because it's got this mucus lining. The stomach cells produce this mucus that prevents the acid from actually touching the stomach lining. And so if you're not making enough mucus, then of course you won't be able to handle any acid. And chances are, if you've been on this medication as far as the Nexiums, if you've been on the PPIs or proton pump inhibitors for years, then your stomach lining may be very minimal because it hasn't needed one since there hasn't been any acid. So take the stomach acid slowly. I always recommend you do it with a functional medicine doctor if you can, but if you want to do things on your own, you can start, but just start slow and work your way up. If you're struggling to get the betaine down, then you want to do some more repair, and we'll talk about stomach repair later on. Mainly today, I just want to talk about stomach acid. So that's the main treatment for improving digestion when you have heartburn. Let me give you a little more motivation as to why you want to come off these proton pump inhibitors, these stomach blockers like Nexium, Prilosec, and Dexilant. The stomach acid is needed to break down your food. So if you're not breaking down your food, that means you can't absorb the nutrients correctly. If you can't absorb the nutrients correctly, then you start feeding the wrong bacteria in your bowels. And once that bacterial imbalance gets set up, then you're at risk for inflammation, heart disease, autoimmunity, tons of bad stuff, and none of it is good. And so that's why the medications, Prilosec, Dexilant, are all associated with A, diarrhea, B, increased risk of pneumonia. Part of that pneumonia risk is because it doesn't do anything for the reflux. You're still refluxing, you're just not refluxing acid. And so when you reflux stomach contents and bacteria that can't be killed because there's no acid, then your risk of pneumonia goes up because that refluxed material can end up in the lungs. Number 3 is it decreases your bone density, so you're more at risk for fractures. And then number 4, that's not really fun at all, is C. diff colitis, which is a terrible infection that most people, when they experience it, wouldn't wish it on their worst enemy. It's a severe intestinal infection filled with just tons of diarrhea, and it's a painful, not pleasant diarrhea and requires pretty powerful antibiotics. So there's multiple reasons to be off the proton pump inhibitors. One of the main things as far as deficiencies that it causes is magnesium deficiency. You need acid in order to absorb your magnesiums and irons and all that. And so if you don't have enough stomach acid, which you definitely don't if you're taking the PPIs, then you won't absorb your magnesium and your iron levels will slowly whittle away. So if you're struggling with either of those, keeping your magnesium up or keeping your iron up, that may be one of the reasons. Digestion is important, and it starts with the teeth, but the stomach is one of the most important processes, and it really begins the real digestive process. So you want to make sure your stomach is working correctly, otherwise the rest of the system is not going to work well at all. Okay, so I hope this helps. Please feel free to leave any comments, questions, concerns. Leave a message if there's something you want me to talk about next in regards to digestion. But I'm going to try to start from the stomach and work my way down. And so maybe one of the next videos we'll talk about other ways to repair the stomach instead of just increasing acid. So I hope this was helpful. Share, like, comment, and you can also visit my website. I've written a series of blogs on this topic itself. You can just type in Oubre Medical reflux in Google and it should pull up my blogs, but I'll post the comment below with the address link. So I hope this was helpful. You guys have a good day.